Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is, what are the best treatments for spinal stenosis? Spinal stenosis is a narrowing of the spinal canal with pinching of nerve roots. It's usually due to bony and soft tissue overgrowth, and typically it occurs in patients who are over the age of 50, and usually it occurs at multiple levels, and it's not often symmetric either. You can see in this cartoon here you start to have some pinching from the front with some bony and soft tissue overgrowth, and then from the back, and it can produce the double whammy there. Now here you see a cross section. This is the elliptical spinal canal that you usually see, although here you have bony overgrowth from these joints from arthritis, and then back here as well from probably an arthritic disc that has turned into some bone and pushed out. So the symptoms of the nerve pinching with spinal stenosis may include aching pain in the buttock and the legs on the affected side, may have symptoms that are almost like sciatica. In unusual cases you might see some leg weakness, and it may be mistaken for a hip joint problem. Typically it's position related. Often when you see a textbook on spinal stenosis, you'll see a person leaning forward on a shopping cart because they'll say, oh, I feel so much better when I'm in a leaning forward position, because what that does is it opens up the spinal canal a little bit and frees up those nerve roots. Now, neurogenic claudication, which is what comes from spinal stenosis, is very different than vascular claudication, which is what comes from peripheral vascular disease. Usually from peripheral vascular disease, a person will say, you know what, my calves hurt every time I walk 50 yards, and it stops when I've stopped to rest. Okay, well, neurogenic claudication is more position related. It's not usually a significant distance or a set distance where it comes on and off. It's usually position. Most people with spinal stenosis actually have no symptoms. They don't know that they have it. So treatment options for when their symptoms are there may include over-the-counter anti-inflammatories and Tylenol. Neurontin and Lyrica are known as neurogenic membrane stabilizers. They can be very, very helpful for pain relief. Physical therapy, spinal decompression therapy, which is intermittent computerized spinal traction. And then epidural steroid injections have been the mainstay for decades for spinal stenosis. So whether or not to have surgery for spinal stenosis is a quality of life decision that should only be made after considerable conservative treatments fail. In fact, over 90% of those with stenosis will be able to avoid surgery with some of these non-operative options, such as the epidurals. If you do go on to have the surgery, a lumbar laminectomy is the procedure, and that may be all you need is that decompression. You might not need the spinal fusion. Okay, so here's what it looks like if you do have surgery. The doctor will, if it's bilateral, they'll remove all this bone here so you can actually free up these nerve roots to the left and the right. Okay, if you're going to do a fusion, they may put some screws and rods in to put these, weld these bones together. It's not always that necessary. 50% end up with stiffness in the back post-operatively. Also, there's always a chance of post-laminectomy syndrome where you get scar tissue forming around these nerve roots, and the pain can come back worse than ever and stay there. The bottom line is that over 90% can avoid surgery. Epidural injections can be repeated every few months. It is a quality of life decision. If the surgery is going to include a spinal fusion, that does add a whole level of complexity and rehab to the mix. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are multiple clinics throughout the state, over 10 in fact, accepting over 50 insurances and providing over 25 different treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.